Qualitative pathologies are conditions where we see alteration of sensations. With paresthesia, we see abnormal, non-painful sensations, while with dysesthesia, we see unpleasant or painful sensations. Both of them can occur spontaneously or in response to stimuli. Some examples of dysesthesia are cutaneous dysesthesia, which means unprovoked skin burning, itching, or stinging without an external trigger, or allodynia, where we see sensations which are usually non-painful, like light touch, become painful. Somatic causes may include variety of conditions like direct tissue damage, diabetes, infections, traumatic brain injury, and so on, and psychogenic causes may also vary. They can present with conversion disorder, asthenic syndrome, anxiety, depression, PTSD, psychotic conditions, and so on. Senestopathies are pathological bodily sensations without corresponding somatic pathology. They are polymorphic, meaning that they are variable in quality and localization, and they are unpleasant, discomforting, or distressing. Senestopathies are also very persistent, and one can simply get rid of these sensations with an act of will. They may last for hours, days, weeks, or months or longer. Also, they have a sense of strangeness to them, and they are often described with as if. That is because senestopathies are caused by disruption of interoceptive and protopathic sensation of synesthesia, normal function of which is to create a sense of bodily integrity. So these sensations are not illusions or hallucinations, but they originate from the body schema and interoception instead of external reality. Now let's look at types of senestopathies. Elementary are vague, undifferentiated bodily sensations that cannot be assigned a specific localization or a sensory modality. For example, a patient may tell us that they feel something strange in their body and be unable to elaborate further. When we move to simple senestopathies, sensations gain a clear localization and sensory quality. For example, a patient may be complaining that their brain is burning, brain being the location and the quality that of burning. Psychosensory senestopathies are more structured than simple, and here we get an addition of spatial characteristics. And patients may even report sensations as if things were acting on their body. For example, a patient complaining and saying that they feel as if something is pressing from inside their forehead. With senestopathies, we're still dealing with pathology of sensation, so objectivation is not happening and objects as such cannot be felt. That's why it's an as-if condition, even when sensations gain more dimensionality and qualities. Parahallucinatory senestopathies are highly vivid, well-localized and structured sensations which feel invasive or external. For example, a person may complain that they feel as if a worm is crawling under their skin. With interpretative senestopathies, patients try to assign a cause or meaning to what they experience. For example, my brain is spinning as if someone is scrambling it with a laser. As for fantastic senestopathies, their main characteristic is that they are described with bizarre and metaphorical comparisons. For example, a person may say that it feels so hot, like red paper burning up. These types of descriptions can be even more weird and grotesque as well. All three types presented on this slide are usually seen as a core or accompanying symptom of more complex psychiatric illnesses, with fantastic senestopathies being typical for paranoid schizophrenia. We may also encounter a senestopathic crisis. This is a condition where a person acutely perceives abnormal and distressing sensations with high intensity or multitudes of them. This can last from minutes to hours and is usually very distressing, leaving patients dazed, confused, and uncertain about their condition. Senestopathies themselves can be a primary symptom or secondary. You can imagine that if they persist for a long time, and especially if treatment is delayed or condition appears to be treatment resistant, a person may secondarily develop anxiety, depression, or even thought disorders. Thought disorders may manifest as hypochondrial ideas, meaning a state where a person thinks that they have an undiagnosed condition and they keep visiting different doctors to get the diagnosis and the help. Or it can lead to delusions. For example, a person may become convinced that there is something supernatural that is causing their symptoms. In such cases, we can talk about senestopathies as prodromal signs or symptoms leading up to more complex psychiatric illnesses.